going to officially call our meeting to order at 8:10. And just as a brief overview of what we will be talking about today, one moment. We are going to approve our January 16th Zoom video as the minutes. Kristen is going to give a brief overview of a topic that we started talking about at the last meeting, which is the board's role in advocacy, and we'll also talk a little bit about information that we can access that is publicly available on the city's website. Dr. Mati will give an overview of the impact report, which I linked and also sent to everyone yesterday, but you should have gotten that a few weeks ago. We'll also get an update on given some of the landscape changing in terms of policy and funding in federal funding and policy change with respect to public health. And then we'll have announcements if there are any, and then we will close out our meeting. So with that being said, I'm going to ask for us to approve our January 16th Zoom video. Do we have a motion?
This is Colleen, so moved.
Do we have a second?
This is Tapie, I second.
Wonderful, thank you. All those in favor of approving the January 16th Zoom video as minutes, please say aye.
Aye.
Are there any nays? Is anyone voting present or in abstention? The ayes have it. We have approved those minutes. All right, I'm going to turn it over to our wonderful Vice Chair, Kristen, and I'll let you lead the next part of our meeting. Thank you.
Thank you so much, April. Good morning, everybody. Hope you're staying warm. So I just kind of wanted to, April and I have been talking alongside having some conversations with Dr. Mati and other staff members of the Department of Health to really try to understand the best ways we can utilize our skills, talents, expertise, relationships to support the Department of Health, particularly and most critically for a time such as now. And so I really don't know how to do things on a small scale. So I'm not sure if this was supposed to be just like a general conversation, but I made a presentation because that's just how I am. So it's not a lot, but it just helps me kind of think of the things I want to share with you all as board members, the things that I hope that we can start doing some research independently, coming together collectively to come up with ideas around advocacy, where to find general information, and what's kind of happening at large, which you'll hear a lot more about what's happening with the Department of Health from Dr. Mati and staff. So without further ado, I'm going to go ahead and share my screen, and I'm going to ask that you all don't make fun of my presentation when I do it. Okay.
It looks good.
It looks, thank you. See, we're already getting started on the right foot. Positive energy, no bad vibes. Okay, so hopefully I won't take up too much time. I hope this can be about 15 minutes because it's really just high level, but I do promise that sometime this week, I will send out some correspondence to board members kind of doing a high level summary of this presentation, just so you can have something tangible, and always feel free to email myself and board chair April, okay? So Department of Health advocacy, through this slide deck, I'm just gonna kind of talk about important things to know, kind of recenter us in what our role is, ways we can advocate. Shout out to Craig. We had some great conversations around board advocacy, and general information, like where to find things where you don't need to necessarily ask someone, but that it's publicly available to you. Please feel free to to come off mute if you have a question, because I'm going to move through the slides pretty quickly. So important things to know. In this current stage, as I understand, we're in our budget phase of planning for getting funding to support the health department's priorities. So one of the things that we should be so front of mind to do is to make sure that we're listening when Dr. Mahdi is saying the priorities of the Department of Health. And if we haven't heard those things, to ask questions around that, reading things like the impact report to understand what's been done and what their historical progress has been as it relates to city residents and their overall well-being. So one of the top things is understand the priorities for the upcoming year. What are the barriers to funding? Some of that we're going to hear today as it relates to the federal impact of funding, because about 50%, if you read the impact report, about 50% of the budget for the DOH comes from grants and federal funding. So if I'm saying that correctly. So understanding what does that look like now? And Dr. Mahdi will share some updates today, but for us to really be have our ears heightened to what those challenges are and use our expertise to kind of come up with strategies to kind of get around those barriers. Role of the board supporting advocacy efforts. This looks like leveraging your existing relationships. What about your friends? What about your friends? Who are your friends? Who are your connectors? Y'all know that song from the 90s, TLC? No? Okay.
Yep.
Okay. All right, Chris, you always got my back. So leveraging our existing relationships matter. It's going to be so important right now to figure out who we already know, who we're already connected with, and start having some real brave conversations with them. And then there's the other component that maybe is later in the slide of just relationship building. Who don't we know that we should know? Who do we need to meet? Who do we need to be in conversations with? It's a political season. The political climate is challenging. There's so many reasons why we need to understand what's happening at the ground level and how we can use our relationships, our newly built relationships, to support the efforts of the Department of Health as board members, right? We're board members, and so our efforts should be investing into this entity. Share your expertise. You're not here because of nothing. You're here because you have something special. You have a skill. You have expertise that we need on this board to move things forward and progress with the priorities that the DOH puts forward. So please don't feel shy. If maybe during meetings isn't your thing, that's fine. You can always, text or call me, send an email, all of those things to share your thoughts. A lot of you do that, great, and you ask questions. And I would just encourage, especially during this time, that we continue to do those things. Understand the role and influence of stakeholders. First, we got to know who those stakeholders are. There are different committees that come together, different boards that come together that's part of the city. And they have public meetings like we do. So figuring out who are the ones that hold influence as it relates to funding, who do we need to talk to, understanding what's important to them. So this is our policy side. Are they the candidate for us? When it comes to the things that are important to them, are they things that we feel like are not as important to the residents of the city? And understanding how we can align conversations around shared interests. Ways to advocate. So at some point, once we kind of get information and we have a clear understanding of all the different things that are happening right now that Dr. Mahdi will share later, some of it will be on us to kind of independently do some research. But I do think separately, we should have some discussions about what our curated talking points will be when we are out there advocating, building relationships, that we're coming from the same angle. We want to be cohesive and say the same thing, right? The priorities that the DOH set out don't change. So as long as we're kind of embedding ourselves into those narratives and making sure that we have a consistent message, no matter which board member you're talking to, that we're standing on business on the same things. So just making sure we're having that conversation, we know what those talking points are, and we feel confident to have those conversations, elevating those talking points. Understanding the methods of advocacy. I love this image because there's so many different ways you can advocate. You can call someone, you can have a meeting with someone, you can write an email, you can send a letter. I don't know if they might accept pigeons too, I'm not sure. But I do think it's good to know the hows and the ways in which we can advocate. And then perhaps the board, we can have a separate meeting to come up with a plan of when there is rapid advocacy, what is our collective response? Do we want to just say, like, when there's something that's needed within 24 to 48 hours? Somebody made a suggestion of having a Google Doc where we start a letter and we curate it and we all kind of agree and say, yeah, this is the message we want to send. When we have more time and capacity to kind of think about something that's not so time sensitive, what are the different ways? Do we want to schedule meetings with people? And I understand different people have different lanes they want to be in. So maybe there's a person on the board who likes to meet with individuals, then we can do that as long as we make sure we have our talking points sound. And emailing, going to public hearings and elevating things is another thing. Meeting people afterwards is another way. So just understanding the different methods of advocacy and then us determining what's going to work best for our schedules and impact. And then just general board information, supporting the health director. So that's like board one-on-one, what our role is. It's just understanding that we're here to support Dr. Madi and pushing for the health priorities of the Department of Health. So things that she said she needs in advocacy, that we're advocating on them, that we're looking at impact reports and understanding the progress that's been made under her tenure, understanding maybe what some barriers and challenges could be, ask questions. You know, what do we think about things that may still be areas of improvement? It's all about pushing things in the direction to ensure that city residents have optimal health and well-being, and supporting Dr. Madi on those initiatives. Engagement with public health initiatives. So that's another reason why you're here. It's something about you and the work that you've done has a lot to do with understanding public health initiatives. So let's tap into that expertise and put our brains together about what that looks like to elevate public health, how public health is necessary, who impacts when people don't have public health, and what that looks like in a psychologically safe way to ensure that we're not just sitting on the board, but that we're also engaging in public health initiatives that invest in community. Understand public health history and context, specifically for the city of St. Louis. I would encourage you all to do that research. I have some articles, again, shout out to Craig, that has sent some comprehensive things over. If you're interested, you know what, I'm gonna send it to y'all anyway, whether you ask for it or not, just so that you have it. But I think it's really important, particularly when you're trying to drive conversations and kind of expand your talking points, or the talking points that we come up with together, is understanding the context and history of public health in St. Louis City, and why Dr. Madi works so hard alongside the staff at the DOH to make sure things are accessible, and the barriers that they face being city residents and city workers. So understanding what's happened to community members, how many areas of the city have been disinvested in health, and the role that this Department of Health plays is so critical in understanding, you know, where we need to go, where we're going, and how far we've come. Understanding key stakeholders and committees. I kind of said this before. So who are the stakeholders? Who are the people we need to get to know? Maybe we already know someone that's a stakeholder, and have we really used that relationship, to support this work, and ask different questions that are outside of these meetings, but just to understand what their perspective is and how we can move things forward using their knowledge and influence. And then how to find important information. That is really just like, I hope you all know that these meetings are available to the public. They are posted publicly on the city's news channel on YouTube. I will send the link out after this meeting so that you know. So it's not just the health department meetings, but you'll see all of the public meetings. So if you're interested in seeing a board meeting from, you know, the Budget and Finance Committee, then you can watch that publicly, the board meetings at that level. There's some alderman meetings that are accessible. So you'll see all the things that are available to you to view. And I think it could be insightful to understand what conversations they're having, and being able to really bring information back so that we can talk about strategy and moving things forward efficiently to really push the best support forward for the Department of Health. And that's it. I think that was record time.
That was amazing.
I hope that was helpful. And that's all I got.
That was wonderful. Thank you. After our meeting last month, Kristen said, I'm gonna take this on as kind of her project to lead, to make sure that we, as a collective board body, could really do a deeper dive into what this topic means for us as a group. So Kristen, I thank you for taking this on, and also thank you, Craig, for sharing all of your knowledge, and also for really giving a lot of the history around how things have worked and currently work in the city, in ways that we can think about our roles as advocates in more effective ways. So Kristen, that presentation was wonderful. Can we also send that to the board after this meeting, along with the other documents?
Yes, and what I'll do, because I know I said a lot of verbal things that's not on the slide deck, I'll leave notes for you to kind of say some of those important committees and the things and where to find certain things with the links. I'll put all that in there too. Thanks, y'all.
I'm gonna open up the floor because I'm looking at some faces, and it looks like people have some comments or some feedback that they want to share.
That was really amazing, Kristen. Thank you so much for the information and sharing that with us to keep us organized. And I look forward to looking at the documents to, to engage more. Thank you so much.
I see Brittany's hand and also Dr. Mati. Brittany?
I want to echo what Chris said. I really appreciated the presentation. I think too often we forget about the multiple ways that we can advocate. And many of us on this call are also greatly impacted by everything that's going on. So if we can figure out a way to move as a united front to uplift one another as well as us ourselves is important. I'm excited to be able to do that.
I just wanted to say phenomenal job. This is the first time since I've been on the board, either as a member or as director, that this has been addressed formally with infrastructure. And so I just really want to thank our vice board chair for that effort. It couldn't have come at a better time. I would say that we are definitely in crisis response mode right now because of some of the federal and state landscapes regarding and the impact that'll have on public health. And so I did want to say that this is not the time to be on a board for public health just to check it off a resume and to pop up on the morning. I believe, once these slides get disseminated, I think I'd really like to encourage people to spend some time with them and think about their spheres of influence and really get engaged. The other thing I wanted to add is, the communications and outreach teams spend a lot of time putting together the monthly and the impact report, a lot of time. And sometimes it reflects that people maybe haven't taken the time to review them because the questions that we get may reflect that. And so I would say that is another way that as a board member at a basal level, that those reports need to be reviewed. It has been a while since I've received any sort of feedback regarding them. And I think some of that is newness. And I understand that leaders on boards are stretched 18,000 different ways. But given the commitment level that was made to be here, I would say that those are another one. They are available on the website. We mail them out to you guys every week. Some of you may be receiving something shiny in your mailboxes if they haven't already made it there, because the team spent all of Friday stuffing envelopes to make sure that you had the physical copies of the impact report as well. So I would say that advocacy begins with knowledge. It begins with a familiarity and really being tuned into what is happening around public health right now. And I know that in my presentation later, I'll be talking to you about kind of the preliminary response and what we are seeing and preparing for and trying to get more information on. So again, Kristen, I'm really, really grateful. I think this will be a packet that we will be using even for orientations for the board moving forward because of how critically important it is. So thanks so much.
Thank you all so much. I'm short of words now. I'm just soaking it all in. I think I saw Colleen, was your hand up?
Yeah, it was. Certainly echoing all of the gratitude, and to Dr. Mati's point, the crisis moment that we're in. I'm wondering if folks could maybe spend some time thinking about who their connections are. I think we could be most impactful if we do a little power mapping and understand where everybody's source of information and connections are. So maybe for next meeting, if folks could think about that and bring that to the meeting, it might be helpful.
I think that's an awesome idea. And maybe in our email with the materials, we can kind of start talking about who we have relationships with.
Yeah, no, that's a really helpful thought. And I've done some network mapping in the past, and I have a tool that might be helpful for us too, in terms of folks thinking about who you know and who may be helpful to have in the ecosystem in terms of folks that have impact on public health in the city. Dr.
Sorry.
Martinez, sorry.
So there was on February 12th, the mayor's office put together a special meeting from the boards of estimates and appropriation. It is in the chat, and I would ask that all of you copy and paste it. And April, if you could send it out after the meeting. Her policy advisor and our national lobbyist put together a really thorough presentation, PowerPoint presentation that is easy to follow about every part of executive orders and federal changes and how they believe that it will affect city government. We spent a lot of time, and I credit our department with being one of the leaders in starting advocacy packets that were used. So they list all of the grants that could be potentially affected. They list, they describe thoroughly impact. And then you get to meet our federal lobbyist. You get to meet Casey Milberg, who is the policy chief for the city of St. Louis, whose office is in the mayor's office. And so that presentation is about an hour, very thorough. And the public health parts of it, again, in my mind, would be required homework for every member of the board, because this team also submitted all of that data and have spent a lot of time submitting that for our federal lobbyist and for the mayor's office. So again, the link is in the chat.
Thank you, and we'll make sure that we send that link out to all the members when we send a follow-up email. Thank you. Any other thoughts about this topic for now? Okay, hearing none. Dr. Mati, I will pass it to you to give an overview of the annual impact report.
Thank you so much. As I am waiting for this to download, I would like for anybody who, I would like to actually start with a question, if that's okay with everyone, and get some preliminary reactions. At least one or two things that that sort of stuck out to you or that you thought were strengths of the impact report, and maybe one thing that you either thought would be an area of improvement. I think that would be great. And then I will go into my presentation. So Kristen's hands up first.
Yes, wanted to say amazing report. It was really comprehensive, and your team put a lot of work. Your team been getting busy, first of all. What I saw throughout the report was just improvement in metrics, increases in interaction services. The outreach team has been doing the thing. and with a new department that's been launched out of or new bureau that's been launched out of your department. So I think that's incredible. I think it was so many people. I can't remember the number. I can't remember if it was over 3,000 or 13,000, but I know that it was a lot of individuals.
13, honey.
13.
Over
Okay, I knew it was a
13,000.
3 in there. And that's amazing to reach that many people within the last year with that support. So kudos to that. Every metric I saw where there should be increase were increases. And then the metrics of decreases like HIV reported cases and so things like that should be going down in number, went down in number. So I thought that was incredible. The one thing that I noticed that your retention rate is stable and that you have a lot more staff that's been on this last year than you have in previous years. So you may be answering this question later, so it's fine if you don't answer now. But I think that's amazing that you've been able to grow the department in that way. And I know that each role is being utilized to its capacity. How does that look in the current climate of being able to create such growth and then have so much of a barrier with consistent funding to support, since it looks like about 50% or 40%, 46% of the budget comes from grants and federal funding?
Much appreciated, and I'll definitely be addressing that during the presentation. I'm going to talk about the report, and then I'm going to spend about 3 minutes giving you my reaction to what has been happening at a national and state level.
Okay, thank you.
Melissa.
Well, thanks. First off, it looks great. It's fun to read. It's got great pictures and graphics and wonderful information. I wanted to point out kind of what Kristen just did, and I think that's a great question, but really like to see the growth in HR and personnel and our team members, right? Because that's who does this amazing work, and also love to see that morale is up. We are all going to need that. We are all our own best sources of resiliency and who we sit next to, right? And having shared mission and values in the work. And so seeing that gives me hope as we move forward. And also love to see all the partnerships that happened and have been happening. Great work.
Thanks, Melissa. It's really interesting to see what shines out to people. I have my own favorites that are very different. And just want to acknowledge Shantae Fluellen, who's on the call. This is literally Shantae's baby. People use that term very lightly, but she birthed the first ever annual impact report in 2022. And for those of you who've been on the board, to just look at the first one, if you go on the website, and the quality of it, sometimes her and I chuckle at how amazing it was as a first effort, but I mean, it's not even close. In quality and depth and all the things, what she's been able to grow this as year by year by year. The author of this, Erin Ford, is not on here, but I just wanted to really give Shantae her flowers. We are one of the only departments that even puts out a monthly report. Actually, we are the only department, and then we're the only one of few departments that puts out an annual report of any kind. It's so important, especially now, and it's, increasing health literacy has been a passion of mine, but just wanted to give kudos to Shantae. If you could virtually clap, emoticon clap, flush the comments up. People do this work, and then, people take it for granted sometimes, but this is a lot of late nights for her and her team, early mornings. And so this is really a credit to Shantae. Thank you, Shantae.
Thank you, Shantae.
And then any other reactions before I share screen?
I just want to share that I was so pleased to see. I mean, we all know that you and your team are very data driven, really focused on measurement. But this document really shows how granular you are tracking your data to make sure that you are using the resources that you have in ways that really impact people, and that you're really focused on maintaining your status as, an excellent public health team. So for me, it shows, all the hard work and all the growth, but also the real focus on the implementing public health standards and best practices that I thought that really stood out in the way that this document was crafted.
I want to really thank you for honing in on that, April. It's your love language of leadership, so it makes sense to me that that would shine out to you. Shantae has a background in quality improvement. She's actually went back to train whilst working full time and has a full accreditation. She has a background in emergency preparedness, not just the communications, but in quality improvement. In fact, the 5-year strategic plan, she was one of the main leaders that saw that across the finish line. So she's very data driven in her leadership and her approach about everything. In fact, when we have inclement weather, she provides the executive leadership and the emergency preparedness team with a full report that has data around emergency room visits, a strategic plan around communication. So it's really speaks to how she leads and how she works and how she sees this. It also just reminds you that we used to have 2 epidemiologists, but one of the areas that we did targeted recruiting and retention at a time where salaries are not nearly competitive for those folks is for our epidemiologists. So we now have a full staff of 11, and they have been the most stable department. No one has left. So Dr. Moshe, who's their bureau chief, has to be commended for the culture that he has built around our epi. So every bureau has a dedicated epi, right? And then we have EPIs that are cross-functional as well. So that leads to us being able to have a performance management system that one day maybe I'll have the EPIs come and show you how granular they track every single aspect of what we do. And they now do reports for partners. So if you look at one of the examples that I'll show you, we did a report around pharmacy deserts for one of our leaders, pharmacy leaders and CEO of Greater Health Pharmacy, Marcus Howard, Dr. Marcus Howard. And so it's those types of partnerships, a partner saying, hey, could you give me a report on that, and that organically starting a partnership that I'll talk about really soon. So I really want to thank you for highlighting that. I'll go to Liz and then I'll share screen.
So I feel like I'm just echoing others. This is very well put together, and I love the call outs with the different data that's in here, and of course, like the photos to just bring it to life. I guess where I'm at, as I was reviewing it and as I've reflected over the past 4 weeks, my main, the main thing on my mind really is just the funding and what happens to so many communities if we don't have outreach to really deliver healthcare in different spaces, whether it's vaccinations, like I'm watching the news, there's measles outbreaks, goodness, why, and things like that, that are totally preventable. And so and with behavioral health too, kind of coming under fire quite a bit right now. And of course, different communities as well, like our LGBTQ community. I just wonder, how do we actually ensure that services are still provided if the previous funding sources are not available? These are just the things that have been kind of weighing on my mind quite a bit. So I am curious kind of what you share. I've been looking forward to this meeting because it's all been on my mind.
Yeah, thank you for that. It's heavy on all of us. For all of us, I can tell that it's heavy on the faces of folks here. So let's dive into it. Would really encourage Shantae for you to capture the messages in the chat. A lot of love, but a lot of really great ideas. And we may need to have a board excursion day to the new urgent care. I love the comments that both Barbara and Morgan have put around behavioral health ED visit data and the interest in the urgent care. So allow me to share screen. So Erin has so much fun with the artwork for this. If you noticed the theme, I was waiting for someone to see if they'd noticed what the theme for the monthly reports were. Every single monthly report highlighted an area of our city. And so this was what she chose as sort of the culminating image to get this started. We shouted you guys out front and center, and I hope you appreciated that. Kudos. To me, that was important before we said anything. It is rare to have a board that is so present. Your work, separate from being on the board, is so important to the region. It fills me with pride. I learned so much from following what you each are doing, and then how you show up for us and for public health Many of you have fought at even national platforms, whether it be reproductive justice with Colleen Imbal and all of her work in public health and HIV services, in the all the geos. I don't know how to say all the geo words right, but all the geos, the depth and scope of the geos. And that's just to highlight a few. Our own board chair right now advancing the health equity across our hospital systems, our vice board chair who brings from an entrepreneurial pursuit, health equity, eliminating health disparities, community engagement, especially for Black and Brown communities. And so I just wanted to thank you all up front and center. We really were excited to have Mayor Jones be a part of this report this year. I think a lot of people underestimate how much she is here, how much she shows up. You could tell there were so many pictures that she was a part of. And even in the accreditation process, they interviewed her separate from me. And I'm not going to lie, I was very nervous. I'm used to staffing her and, you know what I mean, being with her for things. And they were like, nope, you don't get to come. And then they came from the meeting with her and immediately said, we've never seen a city leader or a mayor that's so engaged, knows so much. And I want to shout out Kristen and Dr. Tim McBride, who are also being interviewed with the mayor at the time. And they said, man, these people love public health, love your department, know so much. Like the interview was so rich. And so that was a new addition. Victoria and I just really wanted to get this started strong. So this is the page that a lot of you spoke about, right? We have been tracking retention. And even though this 121 is the number reported, if I had included 2021, which is the year that I started, that number is 85, right? So to go from 85 to, we just cracked over the 140 mark 2 weeks ago. So I was mad that the report came out. I was like, as the report goes out, we made it to 140. You don't see that level of growth. My counterparts in the county, there were layoffs at the health department in the county that's 5 times the size of ours, has 5 times the budget. So to be able to not only have retained, but grown since I joined at the first month in October is something that we're enormously proud of. We also keep track of those turnover rates because I think in institutions, there's a big, sometimes superficial effort to just recruit folks, but not to focus on culture. And that's why the second page is really us saying that there is a strategic plan towards retention is more important to me than recruiting. Luring people like the Pied Piper and then treating them like crap is not the way that I lead and do business. And so this annual survey, this QI experience, really trying to check in. We've changed our executive leadership team meetings. I had to have a reflective moment about how boring, how sterile they were for my leaders. And so we've completely revamped them in January. And so we try to be super introspective. Our fiscal year goes from July 1st to June 30th, but we use January 1st to have a lot of reflection about just same questions I asked you. What were your top 3 highlights for your bureau? What were 3 areas you'd like to see improved? And then a 60-question annual survey that the employees get that holds us as leaders accountable. So extraordinarily proud that every year there's been an arrow up around agency morale, career advancement, and other areas like the supervisor monitoring as well. Funding, I'm seeing a lot of comments in the chat. As you can tell, when I came, we had less than 1% of the city's budget. We still sit at 2.7%. I would note that the World Health Organization cites 5% as the goal for cities to dedicate to public health, and that there are numerous studies that show that a thriving economy is linked to a healthy one. And so I always say to people when I go to neighborhood meetings, you can't have sick and dead policemen, right? If crime is what you're voting on, you can't have sick and dead people fixing your potholes or picking up your trash, or if that's what you're voting along. But let's try in 2025 moving forward to make health what people go to the polls for. That is the charge. That is my first area of advocacy. Is too often, because it's not sexy, because it's not present of mind, health is left behind. You can also tell from this that we are almost 50% grant funded. We want to make that very, very clear. This health department is the largest grant funded health department in the state. And as such, I am the busiest health director in the state because the impact of some of the executive orders and federal cuts that are being spoken about will impact this health department more than any other in the state. That's what this this page should tell you. We wanted to just really shout out the ARPA funds that came to the city. There were close to $500,000 in ARPA funds. The health department was allocated about 15 million, and we give examples throughout the report of where those ARPA funds were passed. I was waiting to see if anyone noticed what the new pages this year were from last year, but since you're a new board, I guess that doesn't make sense because you weren't even here for last year's report, most of you. But policy and advocacy is a new page. I want to shout out Craig Schmidt, who's on the call, who I will always give the flowers to. I don't know what I would do without Craig, his passion for all things health equity, but specifically his experience that most departments would never have as a lawyer himself in understanding policy. This page I dedicate to Craig Schmidt. We have championed 28 bills. Those bills would never be championed without Craig. He does all of the paperwork, the research. He works with the Board of Aldermen. He makes sure that all of those bills make it across the finish line. Those 35 letters of advocacy, if you think I'm drafting them, you're sorely mistaken. That's all Craig, right? So this is Craig's baby, his work. We give you examples so that you can really see what policy and advocacy look like here at the health department as well. So this is a new page. Another new page. Go ahead and Google what health department has a full scale wraparound health equity plan for the entire city that is both internal and external facing. I'll wait. There are none. We will be hopefully publishing this later this year. I want to really shout out our partners, previously known as the Regional Health Commission, now the CHCM, who we went into contract for $500,000 to do this plan, a plan that is really to say, if we are really providing healthcare for all, how do we do that and make sure that our folks are trained to do this work? How do we show up in community to do this work? So this is a over 90-page document with a 12-page primer that we will be disseminating to the board in a few weeks and months once Shantae's team has time to catch their breath, get a little bit of a few naps to catch up for the last 4 months of work that they've been doing just to get this across the finish line. But our commitment to health equity is clear. We once again make clear the importance of FAB reaccreditation. And I want to give you an example of why this is so important. I attend a bi-weekly meeting with all of the health directors in the state. There is a health department that needed encouragement because they were given 47 follow-up questions and areas that they needed to fix before FAB would even grade their health department. When we went up for FAB, we had 5. So it is the amount of work that went into this by Rhonda Bartow, Shantae, Craig, and the team to get this department reaccredited, especially for how small we are, cannot be understated. So we once again make that clear. And then I heard a lot of you talk about the partnerships. We talk about how much we distributed in ARPA funds alone, let alone our own departmental funds into community. So we show up for our partners, not just with words, but with dollars. And so there was a page dedicated to that. And then our new one, one of our newest bureaus that Shantae oversees, the outreach activities. Let's talk about how data-driven she is. There's a dashboard that you see later on that talks about her community outreach events. But just how joyful these pictures are, how DOH is in community, showing up for folks, being there for them. I just really want to shout out the fact that, we spent most of our time in the St. Louis Promise Zone. This is an area that includes parts of North City and city and county designated as part of a federal program intended to increase economic activity, improve educational outcomes, reduce serious violence. 80% of our outreach opportunities were within the Promise Zone. So we are really using, as I say, a data-driven approach. And there's that number that Kristen shouted out, 13,123, because we are tracking. When I came to the department, I would go to community outreach events that would be 3 hours long and I would see 2 people at a table. And it's just not a fiscally responsible way to do outreach. And so we really said, I'm not going to give you money for merch anymore, bureaus. If nobody's coming to these events, you scrap them, you find a partner, you figure out a way to get people to come. And I'm so proud that in 3 years, they really took that on, and we're very strategic about that. The rest of this, I won't get into too much detail about, but you have a report on every single one of our programmatic bureaus, communications and outreach, our EPI bureaus, family, community, school health, behavioral health, environmental health, and communicable disease. This is that dashboard. So later this year, we will also be debuting that every single department, our EPIs have been very busy. Every single bureau has their own dashboard now. They're on TV screens throughout the bureau. For those of you who came to fellowship with us in person in December, you saw the TVs everywhere. You saw the data being circled through. They will be on our website. And we are finding ways, from a suggestion either Liz or Morgan gave me actually, that we could display those across the city at people's campuses, for example, because of technology and how I as an auntie don't know about it. If you didn't read about the Pharmacy Desert Project, please do. It's highlighted in the report. But another one that we highlight is congenital syphilis. These numbers should alarm and scare you as to how much we've seen congenital syphilis go up in the city and across the state. And we're really proud to have worked with the state and the county to put together a put together a response. Maternal child health and doula training, another highlight for our family, community, and school health section. Please check it out. We hosted the first of its kind, and the National Medical Association has been watching this health department and felt so passionately about how the work that we're doing that they came here and sponsored an entire regional event to talk about maternal child health. So grateful to the president here who came, who flew in from Philadelphia to sponsor a maternal child health event last year as well. One of the highlights that you all talked about was the opening of the first urgent care. So you see it here, SSM Urgent Care Long Acting Injection Clinic. If you'd like to have a trip or a tour for the board, chaired April Jolly, please do let me know. And we did try to highlight that we work very closely with our older people in wards. An example here is a pamphlet that we individualize for every single ward. They get their own data around substance abuse. They get their own, on the other side of it that you can't see, they get their own resources that are specific to their ward. So very proud of the fact that we work closely with our wards to try to give that individualized experience. We also talked to you about the impact that we've had since in just the 1 year that the mayor asked us to oversee healthcare in the city's criminal justice center. Deaths had been 6 and 5 in the previous years, each year. And in just the first year that we've been overseeing, those deaths are down to 2, which is within range of the national average. Communicable disease, Pride is one of our biggest events, so we highlight that. And we recently had what I thought was a really exciting event where we had a virtual forum for Black women in St. Louis and to get their thoughts on HIV and sexually transmitted infection resources, something that unfortunately St. Louis has always had hit really high rates. The section leader for this initiative, Tyrell Manning, is also highlighted. He is someone to watch. He is now a national leader in HIV prevention, LGBTQIA+ advocacy, and this is him actually at invited at the Capitol last year to provide a presentation for a congressional committee around HIV prevention and our work here in St. Louis. Environmental health, always in the background, people don't take notice, but when you go out to eat at a restaurant, you want to thank these food inspectors for doing food inspections. And 2,321 critical violations found in 1 year. That should make you pause. That should give you goosebumps. So the work of these food inspectors who are in community every day, community sanitation, right? Anytime a building is derelict, opening pools, making sure that the pools are great. I got a lot of emails from folks around this picture at the end and this baby being one of their favorite pictures of the report. But animal care and control, you'll hear a lot about this when I come to present to you. I just submitted our budget request for this year, and animal care and control is going to be the highlight this year, and we'll talk more about that when I come to give that presentation next month or the month after, depending on when April asks me to. And then awards and achievements. We get busy. We are at conferences. We are awarded. We are nationally acclaimed. We are invited places because we are leading the work in public health. And so we couldn't be more proud of the myriad of ways that this team has been showing up and being awarded. At the end, no excuses for you all. There are phone numbers to call that you can disseminate to your contacts. There are 5 different social media platforms you can follow. So pick one, follow, disseminate. Advocacy starts with dissemination of information, highlighting the importance of our work. So if you have not emailed out this report to your friends, networks, and your spheres of influence, that is your only homework for today, please. This report, we sent it out to about 500 people. I get a MailChimp report, 393 people opened it. Within the next week, I'd like to see 100 more because this board disseminated it, and I can tell if people opened it or not because Shantae doesn't play games and she keeps those reports. I will stop there, take any questions, comments. I know there's been things going on in the chat that I haven't been able to see. And then once I get final questions and comments, I will give you my federal update. Lots of love for Shantae.
Kudos.
Colleen in the chat talking about 2.7% of the city's budget is for DOH. I know we say budgets are moral documents, but looking at the budget breakdown is sobering. A lot of agreement. Barbara and Morgan, thank you for your comments around outreach, around harm reduction, the Behavioral Health Bureau, and the urgent care. Those are well received as well. Lots of love for the EPIs, which I really appreciate, and we will get that back to them as well. And then I love to see the love for Craig, who hates attention, but deserves the praise. Thank you so much, Enbal, for all of the comments as well. And I see the first question coming from you: with half of the funding coming from grants, could we receive information about those programs by grant? A great question. Enbal, as part of the advocacy that I've started in preparations for the Bureau, we have listed every single one of our grants and sent that to our federal lobbyist. We have listed every one of our employees that is paid out of a grant, as that is my leading concern, is I want to be able to retain every single person if I can, regardless of what comes. I'm not sure I'll be able to do that. That is my number one concern for advocacy, is retention of folks and them not losing their jobs and us having to roll back programs that have been a cornerstone of the community. For example, our Health Stop Clinic that is fully grant funded. Has been testing folks for HIV, STIs, linking them to care for decades. And so that is my number two concern. But another project we embarked on, our number three project, was to create an impact document for every single one of our grants, and to give, I tried to have the team focus on economics, since this was all about the economy. So economic impact statements about their work, but just life impact stories as well. So we have a comprehensive policy kit that is a living, breathing document. We add to it, but we have all of our grants, the folks paid out of it, the impact of each grant. We've included our annual reports so that there are examples of stories that are vibrant as well to help with those advocacy. And within the first week of the first executive orders going out, I believe we were one of the first health departments in the country to be able to have a seat at the table at some of those meetings, because our federal lobbyist was able to use that information. The YouTube video that Mayor Jones did with Casey Milberg, you'll see some of that information reflected for you to actually see. And if after seeing that, Colleen, you have any other questions, I'm happy to share that information. So that's a great question. Thank you. So let me move to what's been happening. Someone asked me if I could trade this period for the pandemic, would I? And I said any day, any month, the whole time. COVID-19 pandemic was a cakewalk, and that should be sobering because I'm an infectious diseases doctor who had a baby at the first year of the pandemic as well. So this has been hard. This is hard. So what does this look like for public health? Many of the executive orders that went out directly impact public health. HIV and PEPFAR being rolled back already has had globally devastating impacts. I'm part of some of those meetings, and I cannot underscore what that means. So my concerns are that there is an intersectionality of some of the executive orders that directly impact public health. Number one, we're almost 50% grant funded, and most of those grant funds at a federal level come from our Ryan White programming and our HOPWA and HUD grant funding as well, which means supporting people living with HIV and housing as well for those populations. Then a lot of the language that is being targeted is around the LGBTQIA plus community and DEI initiatives that are also have also been integral to a lot of the work and the funding for that work. So those were where my preliminary concerns. We started to get emails. It was like every day you just didn't know what would happen. So we would hear from a federal agency, you can't draw down funds, like we're having to pay invoices in real time, and you'd get an email from HRSA that says that we're not going to be drawing down funds, and then an email the next day that would be saying we would look into it, and then an email saying please hold. We were supposed to have our site visit from HUD, and they eliminated that site visit. So the uncertainty, right, and the pausing in our ability to do operational activities has also been very damaging. We subcontract out to many partners that rely on our ability to draw down funds and pay invoices. So when those are paused, that has an immediate effect. So that is the second thing that we were dealing with. The hardest week, I would say, was when they started to delete whole websites of public health data, policies. And so once I, due to my contacts at in various places, was tipped off that this was starting, our EPI team spent a lot of time archiving and putting together sources of data. Because it's sad that I have to say this out loud, but the only way that we can go to a school and help a child that has measles is to have access to data that these national agencies track, and then standards, policies, guidelines, and recommendations to support outbreak efforts. So at a time where there was a tuberculosis outbreak in Kansas City, at a time where we are seeing avian flu, human cases, and those numbers going up, at a time where our influenza rates are at the highest they've been in St. Louis for at least the last 6 years, to not have access to certain data repositories and the guidelines and policies to them is unlike anything I've ever experienced in my life, and certainly in my professional career. So I want to really say that our epidemiologists work in being able to put together archived resources, policies, and data. This work was 3 to 4 days, early mornings, late nights, and working through the weekend is something that I'm extraordinarily grateful for them. So we are working on what we would need to do if we didn't have access to these sources of data moving forward, as we try to respond to evaluated programs and to serve communities. That would be another area that is of great concern to me. So we worked closely with the mayor's office and have consistently given them where we believe the threats are to public health. That policy toolkit we gave to them to inform our federal lobbyist who is advocating on our behalf. And I'm just grateful to work in a city where the mayor is willing to call this out, has made numerous statements about this, and where we've already had a virtual town hall, for lack of a better word, that you all have access to help inform even your advocacy. So I'll stop there and I'll take any questions around the current landscape. Oh, sorry. At a state level, many of you may have seen the Governor Kehoe put together an executive order around immediately halting any DEI state-funded programs. Craig Schmidt is evaluating that so that we can understand if that could potentially have impacts on our health department and on the state's health department's ability to support any of the work we do. And once I have a better idea of that, I will also report back. Open to questions, comments.
This is Colleen. This is a rough time, and I want to first acknowledge that, and I think sort of hold space for all of you who are having to do the work in this really, really challenging time. I think probably this doesn't need to be stated, but for me, one of the most overwhelming pieces of it is that it is constantly changing, and so you can't quite catch up to any of the things that are sort of happening. And as soon as you make some changes, new things are happening. So I want to, provide space and gratitude for you all for what you're doing. and thank you for the update. One of the things that I think as a board member would be helpful for me, and I will look at some of the resources that you sent, is, you know, for me thinking about how we could potentially fill those gaps that are going to be created by this ever-changing landscape of federal funding. 50% is a huge amount of the budget. And as someone who understands what it's like to support staff who are grant funded, and then to know that at some point that could go away, it's really difficult. So I think one of the things that we all could be doing is thinking about particularly those staff members' jobs and what the work they're doing is, and trying to think about non-government funded opportunities to help fill some of those grants. So I will commit to looking into some of those things for the department.
Colleen, thank you so much. Everything you said just hits right on. And I couldn't, as you were saying that, I think, you know, we have hired for the first time in the health department's history a grants manager. It's one of the positions that's really hard, that and nurses. So to be 50% grant funded and to have been doing the work that, you know, I've been doing for the last 3.5 years without a grants manager, let that sit. But we now have a grants manager. So one of the tasks, one of her areas of leadership around this policy toolkit that we have to help us prepare for what may come is to list alternative sources of funding. But we know that those are going to be overwhelmed. There are very few places like Robin Wood Johnson Foundation and others that have the ability and the capacity to fund. But a lot of times, even in the new ones that RWJF have just released, they have excluded health departments and they're going to support community-based organizations. So we could use help from all of you in looking at unique areas of funding and emailing them to me as you see them, asking your teams to do research for us and sending them to me as well. Because I have one grants manager who's baby new. So for her to find all of those is going to be virtually impossible, and to be very specific about seeing ones that health departments would be open to. Again, this is going to be a saturated area. Everyone is going to be running to the private pots. So I'm trying to be hopeful, but I am not confident that that would happen. Our federal lobbyist, the first thing he said to me is, Dr. Mata, you're going to have to find new models for revenue for the next 4 years. And so we will likely have to be going to hospital systems and other places to ask for their support. And we lose our ability to be independent, because once we are dependent on co-models, you know, models of co-owning funding, we're at the mercy of those folks, right? And so this could drastically change what public health is, which is public health. It's not, you know, clinical health. It's not academic hospital health. It's public health, right? And so while I'm open to that type of ingenuity, I could really use help and support in how to think about ways to maintain or even increase our budget, which it needed increasing a decade ago, it needed increasing 3 years ago, it needed increasing last year, but especially during this time. So I really appreciate those comments, Colleen. Kristen.
Thank you, Dr. Mata, for just sharing that with us. It is heavy. It makes me really sad. If I can just be transparent, it's a tough time to see things that you care about with all the great work and progression to be challenged so heavily in a time such as this. It made me kind of wonder. So you said something earlier that I'm kind of circling back to, is that one of your priorities is to get health on the ballot, you know, make sure that it's there this year for voting, which I think is important as we think about tax dollars as being a source of revenue. And so I am going to do some work, and I'm speaking to the board members on this, that maybe we need to kind of look at some of the archive files and understand how those dollars are used currently. And if there's any way that there's any opportunity. We know we talked about alternative sources, but thinking of things that could be more feasible to kind of at least sustain the staff. And I think an angle of that could be like an ideal, you know, thriving public health department should be at 5%. And so I think our goal in advocacy should be to get that. You know, we know what we asked for, we may not get, but if we continue to increase every year, perhaps we can get to the place that we want to be. And I know that's going to be really hard right now when everybody is trying to grab the same funds. So I would encourage all of us to do some independent research and share across from us. And I see a lot of things in the chat about like, what do we need to do? And I think we should have a meeting about that and talk about using the impact report as evidence of the work that's being done and why it's so critical. Because one thing I know is when I'm in front of people, you can argue with the wall, but the data is going to tell a story. So if we can lean into that fact, you can try to misconstrue the truth, but it's a lot harder when the data is present in front of you and saying you can't say that this department isn't impactful. You can't say that lives aren't changed because of their efforts. So I think in leading in advocacy, remembering the work that they've done this year in climates that have felt impossible and needing, support to continue to help city residents to thrive, because you won't have voters at the polls if they're not healthy, as you mentioned. You won't have anybody voting for the things that other politicians feel like are important, if we don't get people to actually get there. So I don't know, I'm on my soapbox because it really grinds my gears with people with authority just make very bad decisions that impact folks that need it the most. And so I will be emailing you all after this to kind of talk about ways. I'm already thinking about advocacy task number 1. So come on, task force, we about to get rolling because it's time for us to fight together now more than ever.
Thanks so much, Kristen. It means a lot. And it's hard because I can tell you that Mayor Jones supports me and the health department unflinchingly. She inherited this as much as I did 3.5 years ago. And there are opportunities for us to really think about how we can protect public health. I have the luxury of only caring about one city department. She has to manage all of them, right? And every director is probably telling their board that, their needs and their this and their that. So I'm very sensitive to the complexity of this. And I believe that there are opportunities to do more for and behalf of public health. And I'm really excited to see what we can do together this year to advance that.
I see Dr. Tubby's hand up.
Thank you. Please tell your entire team that we thank them and that we are so glad that they remain in the space and do the work. As someone who's, public health adjacent in community and clinical health, these are much of the same conversations that we are having, right? In the safety net for our St. Louis community. One additional thought, in the funding streams, as well as just to look at where the private and grant funds are coming and some of the good work that may be challenged by the administration, by the federal administration, and those funds to transfer more of that to private funds, and using federal funds in health prevention and promotion in items that are priorities on the federal administration's list. Healthy food, exercise, right? Not all of our priorities are on that list, but some are. And we might have to be very strategic about how we figure that out so that none of the services that are important to our city residents and our region are negatively impacted.
I really appreciate that, Melissa. And I just want to send you love and light. You are part of one of our 4 incredible FQHCs. Your leadership there has been so important to me and to the region. And I know that you all have been already mounting advocacy because you all as well have been grossly underfunded and literally saving the lives of the most marginalized for decades. So I really appreciate your thoughtfulness around that type of innovation, and genuinely want to connect more around that soon. When we both come up for water, friend. That saying didn't make sense, but I want to thank everyone for just looking at the camera and rolling with it, because I don't know how one comes up for water, but here we are. So
I wasn't going to say a thing, but
let me tell you, your
since you
poker
spoke
face was
it.
my favorite because I know you caught it.
Like,
That
Okay.
That's love, because y'all just looked at the camera like, yeah, girl, come up for your water from wherever you are.
We should probably all be drinking water too. I just, this is a tough time. And I feel like this has been oversaid, but I do think it still applies. Unprecedented times. When will we not have those? And I'm looking at the chat and hearing all the comments that folks are making. And I really appreciate the expertise, the passion that this group brings to this board, because this energy is how we need to activate from here on out.
Mm-hmm. Mm-hmm.
Like this is the time for us to really structure our work as a board, to make sure that we're helping support Dr. Mati and the rest of the team, and getting through, and hopefully still thriving in as many ways as possible during whatever is to come. And I also want to thank Morgan for making the point that this is extremely intersectional work. And while the focus of, Dr. Mati's team, especially when you think about the, unique health equity plan, is really focused on people who face the most harm from a lack of access to public health, economic mobility, but these issues impact each and every person. And so as we think about the storytelling and the facts and the data that we're using when we're speaking to colleagues, perhaps policy makers, this work impacts everyone. And we all need to be really conscious that there's maybe improved storytelling that needs to happen to help people understand that public health is vital for the functioning of our city and our region. Morgan, yes.
Yes, I thought I could just share a recent, really relevant story, which is that I went to the emergency department at BJC this weekend because I'm on a blood thinner and I hit my head and it was no big deal, but out of an abundance of caution, I had to go. So I was there for 8 hours. Well, and actually, I could have been there longer. And the waiting room was filled with folks having behavioral health emergencies, experiencing homelessness. And so, I waited a long time in part because it's sort of this catchment tank, for housing issues, behavioral health crises. And so that's an example where we're all impacted, no matter where you sit on the social sort of strata.
Thank you for sharing that, Morgan. And, it's sad that we've reached a stage in our nation's history where we have to convince people that once it affects them, it's important enough for them to consider. It has been hard for me to attend board meeting, committee meeting, all these meetings, and it feels like the charge is let's dilute the truth. Let's innovate around how to make people understand that this should be about community and this should be about supporting those who can't support themselves ahead of our own, right? And I understand that that's the charge, that whatever we can do to bring everyone to the table in a shared understanding and a shared urgency around advancing the mission and the critical programs of public health that they likely take for granted. One of the things that I'm hoping Shantae and I can work on is stories, that make people understand that just because you don't see it, you've taken for granted that public health was always in the background advancing these things. When you drop your kids off at school and pick them up, and they get to just tell you joyfully about their favorite 2 things that day or what their little friend and them did in the recess, public health is in the background, school nurses, a whole host of people, right? And just the ability to keep your kids in school. How many parents were complaining this week about another snow day? Those kids could be in school, but you know when they don't get to be in school is if herd immunity, if we drop below herd immunity, which we are getting closer and closer to in the city of St. Louis, right? And now we have hordes of children getting diseases we haven't even seen. As an ID doc, I've never treated measles, never. And that's coming, right? I have ID docs who are now seeing, right? We have had cases in the city of St. Louis that we have investigated this year of measles in school, right? And so I think it's so important that we need to remind people that just because you don't see it, just because you've become accustomed to expecting it, right? If I have to let go of some food inspectors, you go to your favorite restaurant and you see a little 4-legged creature scurrying across, baby. And again, I want to say out loud how sad I am that that's what it will have to come to, that it's inconvenient for you to eat with a mouse. It's inconvenient for you to have your kids stay at home, and that's when it's going to matter. But thank God I get to serve alongside leaders like you who I don't have to make that argument for. Thank God that I have you all. And that's what makes it easier for me to get up and out the house every day, because this has become really hard. Chris has been asking some really sort of, I think that a lot of them have just been probing questions, because I know, the presentation that Kristen had started a lot of the questions around advocacy, but is asking about starting an advocacy committee.
Yeah, so that's a question that I will pose to the group, I think. And I don't know if this is at the committee level yet, or if we really need a very focused task force. I know there are a few folks who have expressed interest in serving on such a task force. So with the support of the rest of our board, can Kristen and I please take the next week or so to come up with a draft charge for such a task force, and then circulate that with the rest of this group? And then you all can let us know what you think and if you'd like to serve.
I love that you gave choice because it's important. I was just like, we all on the task force. What? No. Okay. Yes. What April said.
Well, everyone will have a role to play, but in terms of what your tasks may be on the task force, some may be more active than others. So I just want to recognize that this is an area of passion for some people, and you might want to lean in. Okay. We have really used this meeting to talk about a wealth of topics that are important and critical. I thank all of you for joining, for sharing and being thoughtful about the ways that you and the rest of us can support public health, especially in this moment. I took a couple notes about things that we need to follow up on. Kristen, if you will share your slides and the talking points after this meeting, that would be great. I will make sure that I circulate the link that Dr. Mati put in the chat for all of us to look at, along with a very, very simple like relationship mapping tool that we can each start to, we can each use to start thinking about who's in our individual circles who is similarly focused on work that Dr. Mati's team is leading. That could be a potential partner, funder, collaborator, etc. Because this is a time for us to be building community with like-minded people and groups, whether there are dollars directly tied to that relationship or not. And then there were a couple follow-ups about things that folks wanted to look at in a deeper way. So one of them was scheduling a tour of the behavioral health urgent care that's at SLU. And Dr. Monty, I will reach out to you about that.
Okay.
And then I also see you put some comments in the chat for all of us.
Yes, I forwarded an email to our board chair and our vice board chair that the city communications lead sent out around areas of advocacy. And so here are the phone numbers to all your representatives that you can call. You can do a little bit of extra digging if you need contact information. I really advise anyone who's a leader should start to have a toolkit available that you can easily also give to your areas of influence. So how to write a letter, where to call. So this is the beginning, getting your little toolkit started. As we continue to build ours, I'll obviously continue to share those with April and Kristen. But with that video, these are also some of the areas where you can make your position known.
Also added in the chat that the 5 calls website is helpful also if you want a structured way of getting these calls done. You're not limited to 5, but yeah. Well, we are over time. I am sorry. Thank you all for joining. Look out in your inbox over the next few days for follow-up. And I look forward to chatting with you all via email in the interim before our March 20th meeting. Our meeting is officially adjourned.